Hey, Dr Syl here. I'm a junior doctor from Australia on the psychiatry training program, and today I'm going to react to some interesting footage titled Schizophrenic Episode on Camera. Now, it's very rare these days to actually see schizophrenia captured on camera because often people who are experiencing psychosis don't have the insight and self-awareness to know that they're experiencing psychosis, so why would they film? But this video has received millions of views and is from a channel called Schizoin through Life, with a gentleman with a lot of self-awareness and promotes a lot of his experience of schizophrenia. So I thought it'd be interesting to make a commentary from a kind of medical psychiatric perspective. So just remember, this isn't medical advice, but this looks fascinating. So let's check out the video.
Hey, what's up guys? Welcome back to another video. In this video, I decided to record me having an episode, which is I'm currently having, and I am going to talk about what I'm experiencing. So, I am currently hearing voices, and they are telling me that there are communist spies out to get me. I've not checked the windows like I normally have because I'm trying to fight it and not like go to that dark deep hole. Here we go. Okay, so there's one voice, it's a man, telling me to turn off the recording software and stop recording. Before I started recording, I'm kind of fading in and out of what's going on, if that makes any sense at all. I don't know. Let me explain more. 1 second, I'm just trying to cope and I'm talking to my parents about how I feel, and then the next second I'm thinking they're communist spies, and I don't even know. I don't know. I should have wrote a script for this, but I'm not functional enough to write a script. But
So let's talk about some of the things he's brought up and talked about. I think he's already reported two of the core symptoms, two of the major positive symptoms of psychosis, right? Which is hallucinations and delusions. Hallucinations. What's a hallucination? Hallucination is having a perception without a stimulus or without an object. So it's hearing voices, for example, without a trigger. Now, often people who have quite a severe psychosis, the voices will be external to their head. It'll sound like they're in the room or going through the walls, and sometimes they're commanding or commentating and derogatory. He's reporting command hallucinations that's telling him to turn off the camera. The interesting thing is that he has insight into these hallucinations, which in olden times, or in decades ago, would be called a pseudo hallucination, a hallucination with insight. And you don't imagine that other people can hear them. Whereas with auditory hallucinations, sometimes you would be surprised that other people can't hear them. All of these things, there aren't any rules because, auditory hallucinations can also come without publicness, without the idea that other people can hear them. So there aren't any rules about what's the difference between a pseudo or a real hallucination. And pseudo hallucination is a term that's come out of favor because it feels like that it reduces the disability associated with hallucinations. So I don't really use the term. And it really doesn't change management or what I do. It sounds like the voices are kind of also telling him that there are spies, or communist spies spying on him, and that previously he has had to check the windows, and sometimes he doesn't trust his parents. That's interesting. So the kind of belief that there's spies spying on you, that can be a delusion, but it sounds like a secondary delusion, not a primary autochthonous delusion. Now, a primary autochthonous delusion is a delusion that comes out of nowhere and that is pure and primary, whereas a secondary delusion is what's coming from a consequence of something else. So, for example, here you have an auditory hallucination as the main thing, and the delusion is the secondary thing to justify the hallucination. So a hallucination saying you're spied on, and so then you have a belief that you're being spied on, secondary to the hallucination. But again, he has insight into these delusions, which doesn't make them delusions. It makes them ideation, paranoid ideation, because he's got awareness of it, which is very good, right? This is a very good thing. He's probably on some form of treatment. He's definitely experiencing early warning symptoms, early warning signs of a relapse, and it's very important for everyone to know their early warning signs. And he probably just needs a bit of augmentation of his ongoing treatment for a brief period to get on top of this relapse. Let's keep watching.
I'm apparently functional enough to record. I don't know.
So that kind of turnaround could have been a response to an auditory stimulus he heard behind him. Another interesting hallucination that happens that not many people read or know about is called extracampine hallucinations. So I've seen a patient who always had the sense that there was just a body. He felt it was a spirit or a person hovering just behind him, right over his right ear. And he would always just be checking over his right shoulder because he would have this feeling that someone was just there. And everyone knows that feeling, like they're being kind of breathed on down the neck, that there's a body just there. And it's called extracampine hallucination because it's not exactly a sensation that is one of the classic sensations. You know, it's not a visual hallucination or an olfactory hallucination or a tactile hallucination or an auditory hallucination. It's a different sense. It's the sense that there's someone just behind you. And you can imagine how disabling and horrible that is. But that's an interesting point he raises about being functional enough to record something going down. Because, you know, if someone is in a full-blown psychotic episode, they're not in reality with you to film anything. Like filming isn't one of the things that their brain is thinking about. You know, it's because they're in another world. So it's very kind of this gentleman and educational for this gentleman to share the early warning signs that he experiences for relapse.
It has nothing to do with what's going on, but I ordered this laser pointer on Wish. It's like a shopping app, just like for cheap things. Ordered it 2 months ago and it came in yesterday. Yeah. It's a laser pointer. See? Look at the background. Pretty cool. I don't know.
That's the one thing you're not meant to do with laser pointers. You're not meant to point them in your eye. Oh, luckily it's Wish. So it's probably not like a very intense laser.
I'm trying to make light of the situation. My necklace broke. I don't know if I mentioned I have this. My security alert or medical alert necklace. It has my name, says schizophrenic, my blood type, and a phone number to call. So in case I go crazy out on the streets and someone finds me, I got this necklace wrapped around. But it broke a while back, and I need to get it fixed. I don't know. It was laying here, so I decided to talk about it. But what I need to be talking about is what I'm dealing with. I'm sorry. I need to get to the point. Oh God, that freaking. I heard a voice all of a sudden just yell, "I got you," and then it made me jump. Yeah, they're very like verbal and out now that I started recording. I don't know if that has to do with anything. They weren't as bad, but now that I started recording, they've gotten real bad. So for those of you watching, it's really hard to explain what I'm dealing with. Unless you're schizophrenic and watching this, then you probably understand. But I mean, I know every person's different, but I think things are mostly the same. Now, I don't know what causes schizophrenia. All I know is that it can be genetic and it's or caused by illness or something like that. But I don't know why. I don't know. There's a lot we don't know.
So I have a full video about the causes or the theories around the causes of psychosis. So it's very complicated. We accept that there's a hyperactivation of a final neural pathway in the brain that causes the positive symptoms, the mesolimbic circuit, and the predominant kind of neurotransmitter receptor in that pathway is the dopamine subtype 2 receptor. And so a lot of the drugs target blocking that receptor so that we decrease these symptoms or that turn down the volume dial of the positive symptoms of psychosis. But why is there that hyperactivity in the mesolimbic circuit is the big question. And there's a lot of theories around it, and it takes hours to talk through them all. But if you want to learn more, check out the other video I made called How I Conceptualize Psychosis, or How I Understand Psychosis.
To block out the voices, I listen to music really, really loud, and it helps block out the voices. So I'm gonna do that, but I'll still be talking to you guys. It's just I like listening to music.
So this is a very common management strategy for people who hear auditory hallucinations. Essentially, you're trying to compete with the internal stimuli with external stimuli. So you're trying to use external stimuli like loud music to drown out the internal stimuli that you don't have control over, the auditory hallucinations. And it really just makes you empathize with how difficult it must be to focus and attend to tasks while experiencing internal auditory stimuli, like auditory hallucinations. Like try and complete an exam or a multiple choice question exam whilst having auditory hallucinations scream derogatory things at you. Like you totally empathize with why life is just so much harder.
If you wonder what kind of music I listen to everything. Like I like all music, but my least favorite are country and rap. Those are my least favorite, country and rap.
Rap is so good.
Don't hate me for that.
Check out Hyren.
But right now I'm listening to Enigma, their 1990 album. It's on YouTube. It's like an hour long. I heard an explosion. Like an old classic footage of a bomb exploding. It's all makes a mushroom cloud. That's what I heard just now. I don't know if that's a message of meaning something. I keep getting these messages or these coincidence stuff, and I think they mean something, but I don't know what. I don't know what their message from. Obviously, someone good, I think, or bad. It could be bad, but I would think there's someone good. I keep hearing this.
Interesting, talking about receiving messages. Often in psychosis, people can see messages everywhere, and that's a problem in thought reference. And we call it ideas of reference, where they see messages in things that aren't meant for themselves, but they see it as targeted to themselves. And that's a symptom of psychosis as well. I guess another interesting thing is when we were talking about primary and secondary delusions in this video, a very common secondary delusion is the idea of having implants in your ears, or implants like, a transmitter has been buried into your skull. That's a very common thing. I was taking care of a patient the other day who thought they were a cyborg because of this. And this is because they're getting the experience, they're experiencing like that they're receiving private transmissions as part, like it's their auditory hallucinations. And what would you do? Like, what would you do if you were getting private auditory signals? You would try and justify it with an explanation. And the only explanation that, a lot of people, well, a common explanation that people can come up with is the idea that there's a special transmitter embedded in them that is receiving these private communications. So that's another example of a secondary delusion, I guess.
Phone ring. This is a common occurrence for me. I hear this phone ring. And I don't know. Hello? Freaking. I just heard a voice on the phone. It told me to kill myself. I hear this a lot, and I really debate if I should or not, but I never do. I guess that's a good thing. I'm gonna put my music back on.
So, suicide, schizophrenia. It's a very, very common way. So a third of people with schizophrenia will attempt suicide, and 10% will die by suicide. There you go. Just ridiculously high numbers, hundreds of times higher risk than the general population. And the stigma is that, these people are committing crimes. I mean, people with schizophrenia are much more likely to be the victim of violence and crimes than perpetrators of it. The absolute worst thing this young man could do is smoke weed or do drugs. I mean, if you have schizophrenia, like command hallucinations with derogatory content telling you to kill yourself, and drug use, the risk of suicide is so high. I would admit him to hospital. I don't know anything about this guy. I don't know if he does drugs or not. Hopefully not. It would be the worst possible thing he could do for his mental health.
And I'm gonna grab my phone again because I threw it across my room. Man, I've been recording for 16 minutes and it feels like only like 2. I really like Enigma. I do. That has nothing to do with what's going on. But I don't know, I'm just...
That's an interesting point he made about his perception of time, because you can get disordered perceptions of time when you have psychosis, and it's not a symptom we often ask about, but it's an interesting symptom. And it probably reflects maybe poverty of thought content. One of the ways that you map time is via your experience. But if you're having gaps in experience because there's like thought blocking or lack of thought content, which is a symptom of negativism, or a negative sign of psychosis. We talked about the positive signs of psychosis. There's also negative signs of psychosis, which is like an inability to feel emotion, an inability to want to socialize, an inability to have any motivation, and also a lack of thought content. Those are the negative symptoms. And so if you have like a lack of thought, you will probably perceive time very differently to someone who's thinking in a normal linear form.
Listening to them, they're awesome. At least the first song of their 1990 album, Sadness, I don't know, something like that. Okay, so the song is coming to an end, and I'm going to go ahead and go back to without headphones, because I'm going to talk about what I'm hearing. because I realized for the video that's what I should do. I shouldn't block out the voices. I should listen to them and talk about what they're saying. So I heard the phone ring. I got to the phone. It was quiet for a little bit, and then I heard a voice just say, "Kill yourself." And so I threw my phone. Okay, they're telling me to look out the window. I know there's not any spies, but I have to look out the window. Like, it's hard. I have to. It's like I need to. Like, I know there's nobody out there, but I need to. So my window is literally like right in front of me. It's dark though, so I can't see anything. Yeah, I don't see anybody out there. But they're telling me there's people out there. I don't know. Well, guys, I think I'm going to end this here. I'm kind of done. I don't feel like recording or anything like that. So, like and subscribe. If you subscribe, hit the bell icon so you know when I post more content. Like it and all that.
I'm sorry, I don't mean to laugh. I'm not laughing at him.
Thank you for watching. I hope this was somewhat educational. I don't think it is, but I hope it helped out. And thank you very much for watching.
Sorry, I don't mean to laugh at all at him. I just find it like, wow, what a world we live in, where people going through a schizophrenic episode can talk about liking and subscribing to YouTube. Anyway, very interesting to see this young gentleman respond to unseen stimuli. I hope he gets the care he needs. He does need some augmentation in his therapy short term to kind of get through this relapse. I'm not sure what his medication strategy is. I will do a video talking about how you do need to treat psychosis with medicines. Like, sorry to be the bearer of bad news, but there's no psychotherapy, there's no talking, there's no ways to kind of beat psychosis without at least a component of the treatment being psychopharmacology using medicines. Psychosis is just like that. If you found that interesting and insightful, please consider liking, subscribing, and leave a comment down below of what you think I should react to next. I wish him all the best. I wish you guys all the best. He's still uploading, so I hope he's doing well. But yeah, other than that, I wish you all just a beautiful day full of love, and I'll see you all in the next video. All right, bye for now.